Have you ever been in a really stressful situation? Maybe giving a presentation, having a difficult conversation, or waiting for important news, and suddenly felt your mouth go completely dry? That familiar, sticky, parched sensation, almost as if you've swallowed a desert? It's more than just an inconvenience. It's a common, often overlooked physical manifestation of anxiety. Today, we're going to explore this phenomenon, known clinically as xerostomia, or simply anxiety dry mouth. We'll uncover why it happens, delve into the deeper mechanisms at play, and crucially, discuss what you can do to find relief and better manage this uncomfortable symptom. It's a widespread experience, affecting countless individuals, and understanding it is the first step towards feeling more in control. So, why does anxiety literally dry up your mouth? The answer lies deep within our primal survival instincts, in what's famously known as the fight or flight response. Imagine our ancestors facing a saber-toothed tiger. Their bodies wouldn't be concerned with digestion or producing saliva. Their immediate priority would be to run or fight for their lives. When anxiety strikes, our brain misinterprets everyday stressors as a similar life or death threat. It triggers the autonomic nervous system, our body's automatic control panel, to shift into high alert. Specifically, the sympathetic nervous system, the fight or flight branch, ramps up. At the same time, its counterpart, the parasympathetic nervous system, which is responsible for rest and digest functions, like producing saliva, gets suppressed. It's like your body redirects all its energy and resources to the emergency, temporarily shutting down non-essential operations. Adding to this neurological shift are the powerful stress hormones. Adrenaline and noradrenaline, released in moments of high anxiety, race through your bloodstream. These hormones not only heighten your alertness and muscle tension, but also alter blood flow throughout your body, including to your salivary glands. They constrict blood vessels, reducing the supply needed for the glands to produce saliva efficiently. And while cortisol, the chronic stress hormone, might not have as direct an impact as adrenaline, sustained high levels can indirectly influence your body's overall physiological balance, potentially affecting salivary function over time. But the story doesn't end there. Beyond this fundamental stress response, several other factors can exacerbate or even mimic anxiety dry mouth. Think about how you breathe when you're anxious or panicking. Many of us resort to mouth breathing, which, as you can imagine, directly dries out the oral cavity, compounding the problem. Dehydration is another significant contributor. It's a vicious cycle. Being even mildly dehydrated can intensify anxiety symptoms, and those heightened anxiety symptoms then further reduce saliva production. So simply not drinking enough water can make the problem worse, both physically and emotionally. For some, anxiety can also worsen acid reflux or GERD. Stomach acid making its way up the esophagus can irritate and affect the salivary glands, creating another pathway to oral dryness. And interestingly, during intense anxiety or panic attacks, our awareness of every physical sensation is often heightened. You might become acutely aware of a slight reduction in saliva, perceiving it as severe dryness, even if your glands aren't completely shut down. This subjective experience is very real and adds to the discomfort.
Now, a very crucial piece of the puzzle, especially for those managing anxiety, often comes from an unexpected source: medication. Many psychotropic drugs prescribed for anxiety and depression list dry mouth as a common side effect. This is particularly true for older medications like tricyclic antidepressants, or TCAs, and certain benzodiazepines, which have what are called anticholinergic effects, meaning they directly interfere with the nerve signals that stimulate saliva production. Newer medications, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, can also lead to dry mouth, though often through different mechanisms, such as adrenergic stimulation or other central nervous system effects. It's a complex interplay, and distinguishing whether your dry mouth is primarily from the anxiety itself, your medication, or a combination is essential for effective management. This is why open communication with your doctor is so vital. Left unaddressed, chronic dry mouth isn't just unpleasant, it can lead to serious oral health issues. Saliva plays a critical role in maintaining a healthy mouth. It neutralizes acids from food and drinks, limits bacterial growth, and helps cleanse food particles. Without enough saliva, you become more vulnerable to tooth decay, gum disease, bad breath, difficulty swallowing, altered taste, and even uncomfortable mouth sores. You might notice a sticky feeling in your mouth or even a grooved appearance on your tongue. So, what can we do about it? The good news is there are many actionable steps you can take. First, for immediate relief and prevention, hydration is key. Sip water frequently throughout the day, not just when you feel thirsty. Avoid dehydrating beverages like excessive caffeine and alcohol. Sugar-free gum or lozenges can stimulate saliva flow, especially those containing xylitol, which also helps protect teeth. Consider over-the-counter saliva substitutes or moisturizing oral rinses, many of which are alcohol-free to prevent further drying. Your local pharmacy often carries brands specifically designed for dry mouth, like Biotine. Second, and perhaps most importantly, address the root cause, your anxiety. Techniques like deep breathing exercises, mindfulness meditation, and progressive muscle relaxation can help calm your nervous system and reduce the fight or flight response. Regular physical activity is also a powerful stress reducer. If your anxiety is persistent or severe, seeking support from a mental health professional, a therapist or psychologist, can provide invaluable tools and strategies for managing anxiety long-term. Cognitive behavioral therapy, or CBT, for example, is highly effective in helping people reframe anxious thoughts and reduce physiological symptoms. Third, talk to your healthcare providers. If you suspect your medication is contributing to dry mouth, discuss it with your prescribing doctor. They may be able to adjust the dosage, switch you to a different medication, or suggest strategies to mitigate the side effects. And don't forget your dentist. They can recommend specific oral care products, monitor for potential oral health issues related to dry mouth, and offer solutions to protect your teeth and gums. Anxiety dry mouth is a very real, often uncomfortable, and sometimes overlooked symptom of stress. It's a testament to the powerful connection between our minds and bodies. While temporary remedies offer immediate relief, true, lasting improvement often comes from addressing the underlying anxiety itself.
Remember, you're not alone in experiencing this. Understanding why it happens and knowing what steps you can take can make a significant difference in your comfort and overall well-being. By being proactive and seeking the right support, you can find relief and better navigate the challenging waters of anxiety.